Today we are reporting an additional 70 cases of COVID-19, bringing the total number of cases in Alberta to 5,836. Of these, 2,942 people have now recovered. Since my last update, we have also confirmed 9 additional deaths in the province. This brings the total number of lives lost to 104. Reaching more than 100 deaths is a somber milestone. 4 of the 9 deaths reported today occurred within the last 24 hours. The others occurred in previous days or weeks. Sometimes it takes time to confirm a death was related to COVID-19. As the number of deaths in our province increases, so does the number of grieving families and loved ones. To everyone who is feeling the pain of losing someone to this virus, I extend my sincere condolences, as well as to anyone grieving the loss of a loved one from any cause. Today, we are further reinforcing our ability to detect new cases by expanding our testing eligibility and the list of COVID symptoms that qualify a person for testing. Individuals who have any of the following symptoms are eligible for testing: fever, chills, a new cough or worsening of a chronic cough, new or worsening shortness of breath or difficulty breathing, sore throat or painful swallowing, stuffy or runny nose, headaches, muscle or joint aches, feeling unwell in general or new fatigue or severe exhaustion, gastrointestinal symptoms including nausea, vomiting, diarrhea, or unexplained loss of appetite, loss of sense of smell or taste, or conjunctivitis, commonly known as pink eye. This expanded list is based on new and emerging information on the virus. The AHS self-assessment tool online has been updated to include all of these symptoms. Adding these new symptoms will allow us to be more confident that we can identify as early as possible the small percentage of cases that may present with more unusual symptoms. One of the other things we have seen in emerging evidence is the possibility of cases that remain asymptomatic throughout the course of their infection. While most people who get infected will eventually feel sick, there are some who do not. In order to improve our chances of finding these cases who may not experience symptoms, today we are also expanding the availability of testing to all close contacts of confirmed cases, whether they are feeling symptoms or not. Considering what we now know about how this virus spreads, including that people can pass it on before they feel sick, and the need to identify and contain cases as quickly as possible, this is a necessary step. The information gleaned from asymptomatic testing does have limitations. It only offers a point-in-time snapshot, and a negative test does not guarantee a person is in the clear. They could still go on to become positive and infect others, which is why close contacts of confirmed cases who test negative will still need to complete a 14-day period of isolation from others. But asymptomatic testing of close contacts is one more tool we can use to prevent further transmission in our communities by identifying positive cases as soon as possible. Finally, one additional testing expansion we are putting in place is a protocol to test all those who are newly admitted to any continuing care facility in the province, as well as testing those who live in these facilities when they are admitted to hospital or when they are discharged from hospital back to a facility. I know we are all looking forward to moving into the relaunch stages. We will get there sooner if we continue to follow public health orders, stay home and take the AHS online assessment if you're feeling unwell, and getting tested if we are instructed to do so. This will help provide a clear picture of how the virus is affecting our communities. It's quite right to be cautious, and I think that there may be some who feel that we've sheltered in place, there's been a storm, and some people may feel that the storm has passed and now we can go out and back to life as normal. And I think what we need to think about is the fact that the storm is still here. The storm will be here for a long while to come, and we cannot wait until we have no COVID at all until we start to reopen certain aspects of our economic and social lives. We need to continue to be cautious together. These businesses cannot open in the way that they used to operate. Everyone has to put measures in place to prevent spread. But it is also true that the longer that we have these restrictions in place, the more impact that has on Albertans, and their health is impacted by that as well. So unfortunately, we do not have any options that are entirely risk-free, and what we need to do is balance these options together and make sure that we are doing the best we can to protect Albertans as we, again, cautiously open up sectors with precautions while looking at our data and making sure that we're evaluating as we do cautiously make these moves forward. But again, this is something that we all need to work together to have happen successfully.